Welcome back to the show. It is Medical Monday, and today we're talking about a topic that is impacting more and more pregnant women, gestational diabetes. Today we welcome to the show Dr. Ivana Vitrano, Hurley Maternal Fetal Medicine expert, to talk more about this topic. Thank you for joining us.
Oh, thank you for having me.
Yeah, so I mentioned there it's impacting more and more women. Talk a little bit more just in general about what gestational diabetes is.
So gestational diabetes really is very anxiety provoking for many pregnant women. So gestational diabetes happens for a lot of different reasons, and I think that a lot of patients wonder, why did I get gestational diabetes? One of the reasons is because in pregnancy we test you, and many women are pre-diabetic or diabetic before they are pregnant and then find out during pregnancy that they have some touch of diabetes. The second reason is that the blood sugars that we use to diagnose diabetes when you're pregnant are much lower than the blood sugars that we use to diagnose diabetes when you are not pregnant. And this is because the higher your blood sugars are in pregnancy, the higher the risk there is to both you and the baby. And so, and then the third reason which is the most frustrating for patients that they have no control over really, is that the placenta as it grows puts out hormones and proteins that work against your own insulin. And so eventually I tell patients, your poor little pancreas just can't keep up and your blood sugars go up.
It's a lot on the body. So talk about some of those complications that people can go through.
So for the mom, the biggest complications are hypertensive disorders of pregnancy or preeclampsia during the pregnancy, a cesarean delivery. Following the delivery, there's an increased risk of postpartum depression and anxiety, which I don't think we put enough emphasis on.
Sure.
And then lastly, long term, you're at a higher than 50% risk of developing diabetes at some point in your lifetime.
So it can have a long-term impact.
Right, and for the baby, after delivery, the baby can have low blood sugars and have to go to the nursery. Or during delivery itself, the baby sometimes can get stuck a little bit coming out because they're a little bit bigger in the torso and in the abdomen. But we're very well trained about how to handle those little challenges.
Well, like you said, it can be concerning for a mother, but talk about how you treat it during pregnancy.
So the most important mechanisms or treatment modalities are diet and exercise. So a person, once they're diagnosed with gestational diabetes, will undergo dietary education, and we ask them to exercise or walk after meals if possible. And we try to provide support. So if a person is having challenges with a diet, we have them meet with the dietitian again during the course of the pregnancy, as well as just kind of emotional support that, you know, this is not uncommon and we can get you through it. If diet and exercise and support don't help, then of course there's medications, and that's what makes people really, really anxious, is starting medications. And we have two that we use. We use insulin, which is an injectable, which people get really scared about. And then there's also an oral medication called metformin. Insulin is the gold standard though, so we try to kind of steer our patients toward the insulin management. But once the pregnancy is over, it's important to understand that all these medications will be stopped. You're not going to be stuck on them the rest of your life or anything like that. And so I think that that's one of the issues people have when they told that they might have to start insulin.
Thank you so much. There's a lot of information to take in there, but as always, consult your doctor if you do have those questions. But again, our thanks to Dr. Ivana Vitrano, Hurley Maternal Fetal Medicine expert, for filling us in on this topic. We appreciate it.
Thank you so much.